Hi, I'm Raul Perry. This article describes the journey of the adaptation process of the evidence-based program Generation-PMTO to Chile's context and also shows some important outcomes of this intervention in the Chilean parenting practices that fill us with hope regarding the improvements of childhood development conditions in Latin America. This study was conducted by the San Carlos de Maipo Foundation, a private non-profit organization focused on promoting the positive development of children. The foundation has established strategic collaborations with various government agencies, non-government organizations, and universities to adapt PMTO to Chilean context in order to successfully address the needs of underserved families. Up to 62.5% of Chilean children between the ages 5 and 12 are exposed to verbal and physical punitive parenting practices. Studies also indicates that Chilean caregivers frequently refer to parenting as a challenge to their mental health due to its emotional and psychological demands, concerning rates considering the country's high prevalence of adult psychiatric morbidity. As we know, most common forms of violence affecting children occur in family settings, and that's why parent training interventions are a highly effective alternative to prevent child maltreatment and neglect, and to reduce child internalizing and externalizing problems. But we also know that parent training intervention dissemination across Latin American countries is extremely limited.
Hi, my name is Luz Cantizano, and continue with the idea, based on these considerations, the problem being addressed in this investigation refers to the high need to disseminate culturally adapted preventive parent training interventions in Latin America context. By implementing this study, we seek to offer a contribution by evaluating the implementation feasibility and the initial impact of a culturally adapted parent training intervention in the Chilean context. Regarding to the methodology aspects, an exploratory and quasi-experimental design was used to evaluate two primary outcomes of the implementation. Implementation feasibility with the adapted intervention and the initial impact of the program. To ensure the cultural and linguistic relevance of the adaptations before, during and after the implementation, a multifaceted process sustained on the ecological validity model was carried out for 18 months of work, and it included a professional translator, foundation professionals, and two bilingual certified trainers of the PMTO program. This article impacts the family therapy fields because its great results and the evidence shows regarding the high relevance of culturally adapting parenting training interventions for dissemination in Latin America context. Some of the main outcomes of the implementation were large effect size changes, like improving family adaptability, reducing harsh discipline, and decreasing child behavior problems. These promising outcomes demonstrate with evidence that parenting practices can be improved by implementing appropriately adapted program in a very different context than the initial one.
As a foundation, we are very proud to share this useful knowledge to guide those who are working on the cultural adaptation of an evidence-based intervention without losing implementation fidelity. As well, this kind of evidence is necessary to promote and guide more effective and efficient public policies in Latin American countries. Thank you for your interest in our work. And if you have any question or need more information, please don't hesitate to contact us.